Joining me now, Elaine Parker from the Job Creators Network. Elaine, always great to have her on. She is my co-host at Trump rallies and events, but not going to be with us Monday, September 9th in Fayetteville. She'll be out of the country, so we're going to miss her then. And she had a great piece in the Washington Times yesterday. We're going to talk about that. Elaine Parker, the communications director of the Job Creators Network and the president of Job Creators Network Foundation. Elaine, great to have you.
Good morning, John. How are you?
Never better. I wish you were here with us at Colonial Downs. You'd have such a good time. And you could have brought your daughters. This is such a good family place. Of course, you're in Florida, so racing for you, no big deal. I mean, it's there all the time. But in Virginia, it's a big deal because we just got it back. It's only 15 days, and we've been dark for 6 years, but now we're back, so we're fired up. Plus, it's date night tonight, so I'm in a good mood.
Well, that's good. Good for Anne. Hopefully, she makes you take her somewhere nice.
Colonial Downs. Where else? Turf Club. Dinner for two. Right? I only bring her to fun places. All right, let's get to your op-ed, Elaine, at the Washington Times. Best thing was the headline, although it was a good article too. It says, "Despite the yield curve, the sky isn't falling," and of course the ones that are hoping for a recession have told us that the inverted yield curve means that everybody will be starving and on the street and lose their homes. Although a week ago, no one even knew what the hell that meant. Can you elaborate, Elaine, on your op-ed?
Yeah, we injected a little bit of comedy on this one because a little bit of Chicken Little, the sky is not falling. And look, I don't mean to downplay an economic indicator as a useful signal and that we shouldn't take it all into account when we're looking at the economy. But I'm just saying it's not the end-all barometer of our economic stamina. I mean, the reality is the fundamentals of our economy are very strong. And, predicting a recession just from this one measurement, as I'm in Florida, is much like our weathermen right now are trying to predict when and where this hurricane is going to hit. I mean, we know it's coming. That's the only thing we know. We know it's going to be somewhere between a Category 1 and a Category 5, and we know it's going to hit somewhere on some day. They're taking in a lot of information to try and come up with a prediction. This inverted yield curve is one piece of information and definitely something we want to look at. But the unemployment rate continues to be at a near 5-decade low. It's sitting at 3.7% right now. It's been below 4% since March of 2018. And our labor markets are so tight. There's more jobs available than people to fill them. I mean, essentially, if you want a job, everyone who wants a job has a job.
Tell me, based on your experience, and you looked into this, the inverted yield curve, right? So how big of a problem is that if you look through history, Elaine?
Well, I mean, look, basically what it means is a scenario in which the earnings from short-term Treasury bonds surpass the earnings of long-term ones. And I don't argue, I don't claim to be any kind of economist, but I'm just looking at the overall picture of our economy. And, but the headlines, again, I can draw the analogy to this hurricane headlines. I mean, we want to heed the warnings, but you would think imminent death is coming. And just like you hear in the headlines of, over the last week or so with this inverted yield curve that, we're headed for a nosedive next week. I mean, yes, over the past 4 decades, there has been an upside yield curve seemingly that preceded recessions, okay? But there's a catch. And when we're dealing with inversions or near inversions, they also occur without economic downturn. So again, it's one piece of information. We can't downplay it. We have to pay attention to it. But there's a whole host of indicators that they have to look at.
Well, Elaine Parker, I think you nailed it with your op-ed. By the way, you can go to the WashingtonTimes.com and find it there, Elaine Parker, WashingtonTimes.com. And her op-ed, "Despite the yield curve, the sky isn't falling." I mean, the bottom line is there's been inverted yield curves short-term when there has not been a downturn. So yes, this is an indicator, but certainly isn't the end all be all, nor is it the chicken little sky is falling scenario, because all the other indicators of the economy are powerful. And the fact that we have wages going up, the fact that we have more jobs available today than people to fill them, right? The fact that the number of people working multiple jobs has come down. And the other thing, Elaine, is that everybody misplays here is the number of people that had dropped out of the job market since the 2008 recession because they couldn't find a job. They had just dropped out. They're coming back now in droves. Let me give you another indicator. These are the lying, fake news, legacy media will never tell you this. Let me tell you the other one. The percentage of former felons that have jobs is at a record level since we recorded that, almost 70%. Felons with jobs. This is a huge problem in the United States. That's why our recidivism is so high. Felons get out, nobody can hire them, they don't get a job, they go back into crime, right? So that's a record. Here's another one, Elaine, right? This is going to knock your socks off, right? The percentage of handicapped people looking for jobs has gone up dramatically, and those that have been hired are at a record level. So we've got new people coming into the job market. We have handicapped people getting jobs. We've got ex-felons getting jobs. The number of people under 21 getting part-time jobs, all-time high. So all the jobs are there for various parts of society. That's the real indicator. Also, people are spending the money that they're making, so that's why consumer confidence is so high.
Absolutely. I mean, you laid it out perfectly. Every demographic across the board. I hadn't heard that about felons, so I think that's fantastic on many levels. But every demographic across the board, Blacks, women, Hispanics, Asians, veterans, are at record low unemployment levels. And again, still not enough people to fill the jobs. And so you take a look at somebody, I don't know if you watched Bill Maher or not, but a couple of weeks ago, he literally said, "So please bring on the recession." I mean, this is a guy who, if we had a recession and we did go into a recession, it wouldn't affect him one bit. He's a multimillionaire. And to
right.
just simply pray we're having a recession, I mean, I see it in the headlines from the media. I see it from the Democratic presidential candidates, and now Bill Maher actually talking down the economy, actually wishing for a recession to hurt real Americans. It makes no sense. It makes no sense. And so the more you talk down the economy, people are going to start to question and be unsure of the economy. But you're right. I mean, as we start to look at consumer spending and retail sales, they continue to perform well, which means that people do feel confident about their own personal finances. And that's a big factor to consider, is how people feel at their own kitchen tables.
Is the real indicator is jobs and consumer spending. Those are to me the most important indicators, and wages. When wages are going up, jobs are plentiful, and spending is maintained. People only spend money when they feel good about the future, right? I mean, if you've got $2 and you want to spend $1.50 of it, but you're scared about the future, you spend 50 cents and put the other $1.50 in the bank for a rainy day. That's what the vast majority of American households do out of fear. Well, people don't have that fear right now. They feel very, very bullish about the economy. But you're right, Elaine Parker. By the way, Elaine Parker with us. She's the communications director for the Job Creators Network. Go to jobcreatorsnetwork.com, the number one organizational advocate for small business and entrepreneurs in America by far. They do so much with so little. Go to jobcreatorsnetwork.com. Elaine, but you nailed it. I mean, it's consumers making decisions. They feel good about this economy, and an inverted yield curve is not really the indicator that a recession is coming, although the Bill Mahers of the world would love to see gloom and doom just so they can advance their own political agenda on the backs of the suffering of middle and lower income Americans. Unbelievable.
It's just one piece of the story, John, and I don't think everybody should put all their weight into that. I mean, the Fed lowered rates a few weeks ago. They met again recently and said that they would, continue monitoring things and that they would take appropriate action to keep the economic expansion going. So this inverted yield curve, important data point, but only one data point. And that's all I'm saying with, everybody shouldn't be screaming the sky is falling.
It is absolutely ridiculous. The business owners that you talk to every day, and I know that's one of the main things that you do is talk to entrepreneurs, talk to other business owners, small business owners around America. Since there's been talk of this recession, what has been their take? What has been a general consensus of the business owners, Elaine, that you've talked to?
I mean, just to boil it down to two words, bizarro world. I mean, our small business owners are telling us that they're reinvesting in their businesses with their tax savings. They've hired people. They're increasing wages. They actually are having trouble finding people to fill their open jobs. And that's a good thing because wages are rising as a result. One of their biggest concerns, aside from labor and finding people, though, is the cost of healthcare, which continues to go up and be a huge issue for small business owners. Since 2010, when Obamacare was first implemented, more than 30% of small business owners have had to drop coverage for their employees because they simply can't afford the rising premiums anymore. And so that's probably one of the bigger issues that we're staring at now.
So what is the Republicans really don't have a plan for health care, as you know. They said they had one and they lied to their donors under Paul Ryan for a 7-year period. It was right up there with one of the biggest Pinocchios ever. So we talked to small business owners. They're concerned about the rising cost of health care, obviously. They certainly are opposed to Medicaid for all because that would be a financial disaster for the U.S., cause a downturn and hurt everybody's business. But what are they saying is an alternative to this?
Well, look, I mean, you said is take a step back and look at Obamacare and the monster that it has become. Like I said, over 30% of small business owners have had to drop their health insurance because of rising costs and deductibles. The premiums, the deductibles, they've more than doubled under Obamacare. I mean, people simply can't afford it. And there's been an incredible decrease to access. So when you look at people who are in the exchanges and have Obamacare, even those who are getting subsidies to actually afford the premiums, they actually are finding out that when they that really all they have is a card in their wallet, to be honest, because then when they go to get coverage, they find that the coverage they had, they're still facing high deductibles, and they don't have access to doctors because a lot of doctors don't take the exchanges. And one of the other things that we have found is that people who are, there's a flight of middle-class people who were getting subsidies and now have had to leave the exchanges. About 40%, which is about 2.5 million people, have had to leave. So again, less competition, less choice, and not as much access to coverage has been a real problem with Obamacare.
What are your members telling you about getting the cost of prescription drugs down, Elaine?
That is a big issue too. Is the cost? That's been ballooning as well. And John, just to give you a little background on what we're doing, we're working. Job Creators Network is working with physicians, nurses, and other healthcare professionals. And we're actually doing a huge market research project to create a personalized healthcare plan that actually takes the politicians out of the process, because politicians are the ones that have always been first in this process. So what we're doing as an organization and working with these healthcare providers across the country is we're going to put patients first so that we can create a product that expands choice and increases healthcare access and affordability. Basically, Americans have certain pillars that they know they want in a plan. It's my health, my doctor, my wallet, and my choice. And that's why we're spending an enormous amount of time on this research and meeting with patients and providers and small business owners. These are the folks who are on the front lines and are impacted by the healthcare system. But what we want to provide them, we have 5 overarching goals in a healthcare product to provide the American people, and that's peace of mind, affordability, protection, pre-existing conditions. When I say protection, freedom to choose, and control, having more control over your healthcare dollar and medical decision making. So we're going to get there, and we're going to get there in just a few months. Mid-October, we're going to be actually releasing and talking about this new product.
You're on the John Fredericks Radio Network with Elaine Parker. She is the Communications Director for the Job Creators Network and the President of Job Creators Network Foundation. Elaine, let me get this straight. So Job Creators Network, which by the way, ladies and gentlemen, was the single pioneer in America to get behind Trump's tax cut early and actually help get it passed. While many Republicans were running and hiding, as you all remember. So what you're telling me is the Job Creators Network is going to get the politicians out of crafting a health care plan that politicians could eventually get behind to finally solve this problem. And you guys are going to do that. Is that what I heard?
Absolutely. We're going to do that in partnership with healthcare providers, physicians, nurses, healthcare providers across this country, talking to the people who are on the front lines. And that includes small business owners, because they employ half of our workforce. There's 30 million of them out there. They are a huge sector in this economy, and we need all of that input. But we're doing something that's never been done before, John. We're talking to these groups in a way that they've never been talked to. You know, politicians and think tanks in Washington have consistently failed to look at the impact on real people, which is a big reason why we're here now. You know, think about how Obamacare was done in back rooms with backroom deals, and they kept talking about how the sausage gets made and everything like that. We're truly developing a personalized healthcare plan of the people, by the people, and for the people.
Wow. And let's contrast this to Nancy Pelosi saying you have to pass it to find out what's in it, to your approach, which is you're getting everybody in it to begin with in order to craft it before you present it. It's the exact opposite, right?
Absolutely. I mean, we're going to get the inputs from the people on the front lines, the patients, the doctors, small business owners, develop the plan, and get the people behind the plan, and the politicians will fall in line.
I love what you're doing,
Elaine.
Elaine.
Medicare for All polls very well because it's a slogan. That's all it is. And as soon as people find out that they're going to lose their private health insurance, that it's going to be eliminated, they know their choice is going to go down. They know they stand to lose their own doctors. They know exactly what that means, and people don't want that. So we're talking to them about what they want.
Well, and you said this before on my show, Elaine Parker, and you're so right. In the absence of an alternative plan, Bernie Sanders wins, right? I mean, that's basically what you've said. Medicare for All, it's a horrible plan. It's a horrible idea, but it's the only plan out there. You want to have a counter to that that makes sense, that doesn't include 220 million Americans losing their private health insurance either from their company or their union. That's also going away. So you taught me that the absence of a plan leaves Bernie Sanders and Elizabeth Warren standing alone. You're right on that. We're out of time, though. Elaine Parker, thanks for being with us. Read Elaine's op-ed. Go to WashingtonTimes.com. Go to JobCreatorsNetwork.com for more information. Elaine, thanks for being with us. Have a great weekend. This is the John Fredericks Radio Network.